How do you treat sudden oak death?
So the treatment approach for handling the disease, I mentioned earlier how we monitor for the disease. So once these areas have been located, we know that sudden oak death is in the vicinity. Basically, the ground crew goes out and marks all trees that are symptomatic, so showing sudden oak death infections. And once this has been mapped out, they basically go in, they cut down all the tanoak, they pile and they burn them. And they also pile what we call a buffer strip around the edge, so just in case they miss some of these infected trees. And the size of that buffer strip will vary depending on how much tanoak there is and the funding available to treat the area.
Are there other diseases that are greater threats to Douglas fir along the Coast Range, or is this the sort of leading threat right now?
That's a difficult question to answer because basically we don't know what's going to happen to mature Douglas fir trees. To date, the outbreak in California, there's been no significant impact on Douglas fir there. I think the big question here is the fact that we have a new strain of this disease that can infect Douglas fir. What is going to happen in the future? And the thing that's a little bit alarming is that in Europe, where they have this EU1 strain, and they have it in close proximity to Douglas fir plantations, those bigger mature trees do become infected. So there is a potential threat to Douglas fir, but at this point it's not something that we want to become too alarmed about.